This May, the Congressional Caucus on Foster Youth brought its national listening tour to the Pacific Northwest.
Seattle has been a leader for a long time in terms of the Casey Foundation and some of the other groups that are here, in terms of their providing money for a variety of things. And so there's some things they want to show off here in the city.
Representatives Karen Bass, Dave Reichert, and Jim McDermott were part of a larger delegation that learned about Washington's progressive data sharing and judicial initiatives to better serve at-risk and foster youth. They also heard the stories of youth advocates.
As a member of the Mockingbird Society's youth network, we live by a simple phrase: nothing about us without us. I was able to advocate for myself when DCFS decided they wanted to dismiss my case at the age of 17 with 8 months left to go till I turned 18. I asked the judge to not dismiss my case because I felt that I deserved the chance to have the college scholarships, which I am now making use of, to go to college.
A recurring theme was the role of federal finance reform in rebuilding the foster care system.
Congress is obviously a very important part of that conversation. We think they've made a number of incremental moves over the last 5 years that have made things better, but now it's time for a full conversation about finance reform.
I can tell you that if government doesn't become more higher functioning, then philanthropy cannot substitute for the lack of effort and capacity in the public sector.
We have cut over $150 million out of child welfare over the last 4 years.
Just like every place we've gone, there's a number one issue that always comes up, and it's interesting because it's not the system saying we need millions and millions of more dollars, but it's the system saying, please allow us to be flexible with federal money so that we can prevent bringing kids into the system.
Day 2 began early. With no time to enjoy the city, guests headed to 24th Avenue, where 3 innovative nonprofits are housed. Among them, Treehouse is working to improve educational outcomes for students in foster care.
Everything that we have done at Treehouse, everything that we've learned about what kids need to succeed, indicates that we have to start earlier and stay longer with them. But we need to be proactively planning and working with a kid to the future. Now that sounds really simple, but I think because of this ever-changing group of people working in kids' lives, I don't think anyone is really doing it.
Maybe then they started thinking about going back to school, took a quarter here, a quarter there. So there's a lot of a lot of this in their educational experiences. We have parents as well.
The tour then traveled to the University of Washington, where the topics were strategies for implementing evidence-based practices in foster care and the overprescription of psychiatric medications. Donna Evans delivered a harrowing account of her experience with improper medical care.
After reviewing my records, I discovered that the foster care system paid almost $15,000 a month to lock me up and force me to take these drugs I did not want.
By the end of the presentations, the resolution was clear.
We all need to work together. It's not just me being a therapist or somebody being a doctor or somebody being a caseworker. We all need to work together to make sure that it's in the best interest of the family and the child.